Buenos dias, this is Scott Oliver with CostaRicaHospital.com. Here today with Dr. Adam Paer, who is a gynecologist and an obstetrician. Dr. Paer, thank you for being with us.
Pleasure.
If you could give us a clear idea how your education, your qualifications, your experience compares to a doctor in the United States that does what you do.
Okay, well, I came here to Costa Rica when I was 10 years old, and I studied grammar school, high school, university here in Costa Rica. And I did my specialty in Hospital Mexico, which is one of the main public hospitals in Costa Rica. And really, if I compare myself to professionals in the United States, I think we're more or less on the same level. So the quality of education in medicine in Costa Rica is excellent. Mm-hmm. And we actually start practicing on live patients. So we have a lot of practice.
Okay, and when was it that you graduated? How long?
In 1994.
Okay, so
pretty. Been in this for 16 years.
And last time we chatted, I think you mentioned you were delivering 100 plus babies a year.
That's correct.
So you're personally responsible for a lot of these young people running around right now.
That's right.
With regards to the areas that you specialize in, obviously this is a pretty big field. What sort of problems do you tend to get involved with most of all?
Okay, well, there's general obstetrics, which is everything that has to do with pregnancy and deliveries and postpartum. And then we do contraception afterwards, make sure that the population doesn't increase too fast. Mm-hmm. And then we do all kinds of gynecological surgery and gynecological diagnostics. We do ultrasound, we do colposcopy, we do pap smears. We deal with benign tumors of the uterus, the ovaries, fallopian tubes, vagina, all those things.
Excellent.
Mm-hmm.
Dr. Adam Paer is quite well known to us because he was the gynecologist for Nurse Mary Hickox's third child, so Nurse Mary is certainly familiar with him. The other thing we had recently was a letter from one of our VIP members from Oregon who came down here and had a vaginal hysterectomy with Dr. Paer. With all her research in Oregon, she had looked at all the various hospitals around and ended up coming to Costa Rica and having the hysterectomy done with Dr. Paer. And even with the travel expenses and a very pleasant rest afterwards here in this land of stunning scenery and smiles, she saved half. So Dr. Paer, I would like to ask you a question. With regards to the types of cost savings, I'm assuming it depends on the type of procedure, but what are the big things that you get involved with?
Okay, well, the main surgeries that we're involved in, Scott, obviously are gynecological surgeries. And basically we're looking at benign disease mostly, which involves abdominal hysterectomies, vaginal hysterectomies, prolapse surgery. That is when the bladder falls out, the rectum falls out. We apply meshes for urinary incontinence. And we do surgery for benign ovarian cysts, solid ovarian tumors occasionally, anything that appears in the pelvis, any pathology that appears in the pelvis. A lot of women come in to treat fibroids. Some of these fibroids are on the outside of the uterus, some are on the inside of the uterus. Some women need hysteroscopy. For instance, I just received a case of a large intrauterine fibroid, and secondarily this woman has infertility. So we have to go inside the uterus and remove this fibroid, and possibly, very possibly, she'll be able to get pregnant afterwards.
One of the other things that's somewhat unique about Dr. Adam is the fact that he's a pioneer here in Costa Rica with regards to water birthing. And so why don't you give us a clear idea what that's all about, Adam?
Okay, well, water birth is a technique that's been in use for decades already in the world. Dr. Michel Audant in France was the pioneer, actually, and this was in the 60s. I got involved with water birth for the first time when I was a general practitioner in Monteverde in the mountains of Costa Rica, and I was doing my social service there, and I saw a speech about water birth, and I thought it was excellent. And actually, when I did my residency, I found out that natural childbirth is really the way to go if you can, which means basically the basic philosophy is to not intervene unless it's really necessary, because childbirth is a natural process.
Sure.
Of course, occasionally we do have to intervene, and that's what we're in the hospitals for. We do water birth in the hospital. Now we have it's called a birth pool in a box, and it's an inflatable pool with hospital grade, and it has each patient gets a liner, their own liner, so it's really hygienic, it's really clean, and we use the water for an hour and a half to 2 hours maximum towards the end of labor, and this helps the patient relax, reduces their blood pressure. There's a relative absence of weight in water, so they can have freedom of movement and get in any position they want, and actually the force of gravity helps the baby come down. And the main objective is not for the baby to be born in the water, but more to relax the patient.
Excellent.
And we've been doing this since 1998, so it's...
Were your own daughters
actually,
babies?
my three daughters, the first two were born at home, and they're 15 and 13 now. So that was when I was just getting started. I did around 50 home births, which I don't do anymore because I'm so busy that I just don't have time to go home to the homes. Actually, it's a nice experience, but it's kind of unnerving sometimes when you have to move the patient to the hospital.
Sure.
In some cases, although it's rare.
And tell me, what is it exactly you love about being a doctor?
Well, gynecology and obstetrics is really nice because, first of all, it has all the medical specialties involved. It has surgery, it has internal medicine, we have endocrinology because we deal with all the hormone disorders. It has pediatrics, it has all the specialties combined. So it makes it really interesting. Diagnostics, ultrasound and several other things. And the other great thing about gynecology and obstetrics is that most of my patients are young. So they don't get into much trouble. They're usually healthy, and we have good prognosis and good results.
Excellent. Most of the surgeries that Dr. Adams is involved with are, of course, fairly major, but he does get involved with minimally invasive surgeries, including laparoscopic. Could you tell us a little bit about that, please?
Well, Scott, most of gynecological surgery nowadays can be done laparoscopically. In other words, we can do vaginal hysterectomies assisted by laparoscopy, or we can do total abdominal hysterectomies by laparoscopy also. Ovarian cysts can be done by laparoscopy, and endometriosis, which is a disease that affects many women between 30 and 40 years of age, that can produce very painful periods and also infertility. So that's one of the reasons to do laparoscopic surgery. We also do diagnostic laparoscopy and hysteroscopy, which is to look inside the uterus for pathology such as polyps, fibroids, or any other kinds of disease that we may encounter.
Can you give us a clear idea about the kind of techniques you use and the kind of equipment that you use and how that might differ from what a doctor would use in the United States?
Well, Scott, here in Costa Rica I always joke with my patients sometimes and say that they have to come to Costa Rica to get real high technology because we have state-of-the-art equipment, and one of the great advantages is that it's very personal. So I do everything here in my office. I see the patient, I have the office visit, we do the clinical history, we do the physical examination, we do the ultrasound, we do the LEAP procedures, the colposcopy, everything's here. So I use now a GE Voluson Pro ultrasound, which is one of the state-of-the-art ultrasounds in this moment. And of course, surgically, the private hospitals in Costa Rica have the latest equipment for general surgery, for laparoscopy, and of the most renowned brands that exist.
Excellent. So when it comes to gynecology or obstetrics, Dr. Adam is here, and I'd like to thank you very much indeed for your time today. Dr.
Thank you,
Adam.
Scott.
You're welcome.